It's a delight to welcome you onto this episode of your informative and educative program, NAFDAC and Your Health, the program that gives insight into the regulatory activities of NAFDAC, the agency charged with the responsibility of safeguarding the health of Nigerians. I am Opejemi Urimolade. On today's episode of NAFDAC and Your Health, in commemoration of the World Breastfeeding Week, we will be starting with the numerous advantages of breastfeeding, the effects breastfeeding can have on babies, and why mothers should defy all odds to ensure they breastfeed their babies. This will lead to highlights from the recently held commemoration of the World Breastfeeding Week, marked by NAFDAC, and then we will bring you some updates on NAFDAC's activities. Breastfeeding is one essential responsibility that mothers owe their babies to give the babies a strong foundational factor for growth. But nowadays, most parents have neglected breastfeeding for substitutes, extremely less beneficial means of feeding newborn babies. Research has shown, however, that breast milk contains all the essential nutrients that babies need to grow properly and remain healthy. Therefore, nursing mothers need to adequately and exclusively breastfeed their babies in the first 6 months of birth. As the world marks the 2025 Breastfeeding Week, an annual week of commemoration set aside by the WABA, WHO, and UNICEF between the 1st and 7th of August, NAFDAC, as usual, emphasizes the importance of exclusive breastfeeding for newborn infants, especially in the first 6 months of birth.
Because they have natural products that come out from the milk that are supposed to start building the immunity for life for the children. Once the immunity is set up from breastfeeding, the probability of having very serious illness is reduced. That doesn't mean that child will not be ill, but at least the infections that will ordinarily kill a child, or become fatal will be much reduced. That probability will be reduced. A child is supposed to be breastfed fully for 6 months. But reality is sometimes the woman goes back to work. How do you then breastfeed fully? There are now cheaper pump to pump the breast milk and put it in bottles and take it to the daycare. So, in fact, there are organizations that are into making sure that the pump is affordable. The best thing is to breastfeed for 6 months. And then after that, it can be mixed with regulated products, baby formulas, for 2 years. So breastfeeding should be for about 2 years. But 6 months, extremely important. If the woman has a problem, medically, then that is an exception, not the rule.
Nursing mothers play a vital role in establishing a foundation for healthy growth and development for their children, and therefore deserve maximum care and attention.
Nursing mothers are supposed to be treated specially. They are supposed to be treated specially because they are setting the baby up for healthy living or healthy adulthood. In some societies, you have nurses or social workers that actually come to the house to show the nursing mother how to breastfeed, how not to be discouraged if the milk is not coming out. But unfortunately, we don't have that here. However, the people surrounding the mothers, mother-in-law, sisters, whatever, should know themselves that they need to encourage the young or the new mother to breastfeed. NAFDAC goes out to encourage, to do community awareness, enlightening discussions in terms of breastfeeding, encouraging women to make sure that they breastfeed for 6 months. Sometimes it's difficult. Sometimes the baby may bite on the breast and then it's difficult to breastfeed. Use the other one, you know. So it is a little difficult when it has led to a compromised health issue. But it is the encouragement from those that surround the woman that, for example, the first few days the milk may not come out very well. But you keep drinking and drinking and getting the baby to breastfeed, because even more the breastfeeding act itself or process brings the milk out. Again, women have to be supported, because if you don't eat well, you may not be able to get enough milk. So women have to be supported during breastfeeding, or as soon as they have their babies. They should eat well. It's not like rationing food for the woman or rationing drinks, you know, beverages, even milk or water even. So it is important that the woman in herself should be the focus. A woman cannot be selling guguru all over town without drinking enough water. The milk will not flow very well. So the woman is very, very important. That's the manufacturing site, if I want to use that word. For mothers, make sure that you breastfeed, drink a lot of fluid, a lot of water, a lot of orange juice, or a lot of oranges. You don't have to go and buy the juice. You know, just buy oranges and fresh food, fresh fruit rather, because you are setting your child up for good, healthy adulthood. So it is just encouraging the nursing mother, and for the nursing mother to know that, you know, it's not going to start flowing, you know, from the first day, but keep at it, and not just get tuned out and opt for the formula right from the word go. No.
You're still tuned to NAFDAC and your health. Please don't go away.
The first 6 months of a baby's life brings that first grasp, that first smile, that first laugh. For the first 6 months, don't give water. Breast milk has everything baby needs to grow strong and sharp. For the first 6 months, give baby only breast milk, no water.
Start strong. Zero water exclusive breastfeeding for better future. This message is from the Federal Ministry of Health with support from UNICEF, Alive and Thrive, and other nutrition partners.
Welcome back. Thanks for staying tuned. NAFDAC, as usual, joined the rest of the world in commemorating the World Breastfeeding Week. The occasion gave room for an assemblage of relevant stakeholders to discuss breastfeeding and why it should be sustained against all odds. The theme for this year's commemoration is Prioritizing Breastfeeding, Create Sustainable Support System. The NAFDAC Director of Food Safety and Applied Nutrition was among the key speakers at the occasion.
The code is a document that was put in place in 1981, and since 1981 it has had to keep track with current realities. It has had to keep track with and pace with marketing tactics, and so we have resolutions that are brought forward by the World Health Organization, and we call them World Health Assembly resolutions. And what they try to do is to bring the code of 1981 in tune with current realities. So the code remains the code. It's read in conjunction with every subsequent relevant World Health Assembly resolution, and they all have the same legal status.
The benefits of breastfeeding cannot be overemphasized. Breastfeeding actually supports growth and development in the child, because The nutrients in breast milk complement the immaturity of the organs, because what adults could cope with, complex complex nutrients, the breast milk has brought it to where the child can easily take it in and make use of it to grow and develop. In terms of the mother, it protects the mother from various illnesses. It has been documented that some cancers, like breast cancer, ovarian cancer, are actually reduced with breastfeeding. High blood pressure, diabetes. Through breastfeeding, the mother can also, have very low incidence of those kind of illnesses. Then, the nature actually provides for, to a large extent, for the feeding of the baby. And these are what the mother is supposed to use in those deposits that have been laid, that fat that have been laid down during pregnancy is what she's supposed to use to breastfeed her babies. So if she breastfeeds, she releases those fats, and that helps her to control her weight.
And now, moving on to NAFDAC news updates. NAFDAC is alerting the public to the recall of amoxicillin 500 mg with NAFDAC number A4100178 and batch number 322584, manufactured by Splash Biotech Pvt Limited. A batch of amoxicillin 500 mg capsules manufactured in October 2023 and expiring in October 2026 was sampled from a facility in Sokoto and 2 facilities in 2 local government areas in Plateau State. The capsules were analyzed using high-performance liquid chromatography and Fourier transform infrared spectroscopy. The laboratory analysis report showed that the API content was significantly low at 26.3%. Furthermore, the weight variation and infrared absorption spectrum of the sample residue did not meet the established specifications. This indicates that the product is substandard, which has led to its recall. Although Medville Pharmacy, the marketing authorization holder, claims that it got the product from the manufacturer Splash Biotech India, and indeed, the name of the said company appears on the pack of the product. But Splash Biotech India has declared that it has no business relationship with the marketing authorization holder. Amoxicillin 500 mg capsules is an antibiotic used to treat various bacterial infections, including respiratory tract infections, ear infections, sinus infections, urinary tract infections, and skin and soft tissue infections. It contains amoxicillin, a penicillin-type antibiotic that works by inhibiting the growth of bacteria. Stating the risk involved in taking the capsules, NAFDAC says amoxicillin 500 mg with low levels of amoxicillin may lead to therapeutic failure, antibiotic resistance, increased risk of complications, misleading clinical assessment, and poses a risk to public health. Healthcare professionals and consumers are advised to report any suspicion of the sale of substandard and falsified medicines or medical devices to the nearest NAFDAC office. The National Agency for Food and Drug Administration and Control, NAFDAC, has seized banned, expired and unregistered products valued at 1.5 billion naira during a major enforcement operation at the cosmetics section of the Lagos Street Fair Market. Led by the Director of Investigation and Enforcement, Dr. Martin Seliyomade, the raid uncovered several warehouses stocked with cosmetics, food items and other NAFDAC-regulated products lacking registration or date markings. Over a trailer load of such products was evacuated while another trailer of cosmetics was intercepted. The driver fled, but the trailer was secured by NAFDAC personnel. This operation forms part of NAFDAC's intensified nationwide crackdown on unsafe consumer goods. The agency urges the public to remain vigilant, avoid unregulated products, and report suspicious items. This is one of the largest seizures in recent months, reinforcing NAFDAC's commitment to protecting public health. The National Agency for Food and Drug Administration and Control, NAFDAC, is pleased to announce that the World Health Organization has officially confirmed Nigeria's sustained achievement of Maturity Level 3 (ML3) for the regulation of medicines and vaccines as of 30th June 2025. The achievement follows WHO's formal re-benchmarking exercise conducted in Abuja and Lagos from the 25th to 29th November 2024, and 5 follow-up institutional development plan meetings held between February and May 2025. These sessions were convened to review NAFDAC's progress in implementing key recommendations towards completing the re-benchmarking process. The successful closure of all critical recommendations marks a significant regulatory milestone for Nigeria, as it confirms that NAFDAC continues to operate a stable, well-functioning and integrated regulatory system for medicines and vaccines. NAFDAC is proud to be the first national regulatory authority in Africa to maintain the WHO ML3 status, underscoring the agency's leadership and excellence in regulatory oversight on the continent. According to the NAFDAC Director General, Professor Mojisola Adeyeye, this remarkable accomplishment would not have been possible without the unwavering dedication, technical expertise, commitment and resilience of all NAFDAC staff across the country. Their efforts have been instrumental in positioning Nigeria as a model for regulatory excellence in Africa. Professor Mojisola Adeyeye added that NAFDAC remains committed to continuous improvement in regulatory standards, safeguarding public health and strengthening Nigeria's position in the global health landscape. That was NAFDAC Update. You have been updated.
I hope you enjoyed this episode of the program. Make it a date with us, same time, same station, next week for another informative package. Meanwhile, we will be glad to have your comments, complaints, and reports on suspected cases of unwholesome food products, fake drugs, and other related issues. We're easily accessible.
You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded.
Importing, producing, advertising, distributing, or selling of fake food products, drugs, and cosmetics are life-endangering and illegal. Be part of the fight against them so that our nation can be safe. Till we come your way again next week, stay safe.